You, of course,
good to be here.
With St. Vincent and Arkansas Urology. You just said you guys expanding into North Little Rock.
That's right. We have a new office, hopefully opening up in the next 6 weeks or so over North Little Rock to serve that portion of the community.
That's wonderful because they certainly need your help. They've called in this morning with questions. So let's get started. And Marilyn is up first from right here in Little Rock. Hi, Marilyn.
Hi.
Hi. What's your question for the doctor?
My question is, I was just recently diagnosed with 2 masses in my left kidney, and I've been scheduled to see urology, and I was wondering what would urology be able to tell me from this point?
Well, most time, I'm assuming that you've had some kind of CT scan or some kind of a radiologic imaging study of some sort.
Is that right, Marilyn?
Yes, I have.
Okay.
Okay. Well, it will depend on what those studies show. Masses in the kidney can range from simple cysts that are, largely benign to obviously more worrisome problems, particularly renal cell carcinoma. So anytime there's masses in the kidney, and that's usually a urologic workup, that we do some imaging studies and to see exactly what we think it is. If it's renal cell carcinoma, some sort of surgery or intervention is warranted. Masses that are more cystic in nature, that we're not certain of the diagnosis, then we may follow those over time, and it may not result in surgery, at least not right off the bat.
Okay, so it sounds like she's progressing as she should with going to her urologist.
Absolutely.
And having those scans done. Okay, thank you, Marilyn, and good luck to you. Helen is up next in Russellville. Hi, Helen.
Good morning.
Good morning.
Doctor, my question has to do with the filtration system of the kidneys. I just wondered if there are any foods or juices or anything that might help those. I'm an older person, obviously, and had some problems with kidney in our family, and so I understand that is a real concern. Would you have any suggestions there?
Yes, ma'am. As you age, sometimes there's a tendency for some folks to reduce their fluid intake, and fluid is really primary. And you need to make sure you stay well hydrated for your kidney health. Now, there can be some filtration issues which are not always addressed by a urologist. They're more often addressed by a nephrologist. The nephrologist is the medical doctor of the kidney, and they're the folks that look at kidney function to make sure filtration and all the electrolytes stay in balance.
So drinking a lot of fluids, but is water as good as the best?
Well, water is probably the best. Oftentimes, a lot of people, quite frankly, don't like the taste of water, at least not by itself. And so I'm more interested in somebody with the volume of fluid, not necessarily, specifically water. If a lot of folks won't do that, but if they like iced tea, if they like, other flavors, you can flavor water these days. Sometimes that's an option. But particularly in the as it starts to heat up in the summer, hydration is very important. If you don't stay well hydrated, you're at placing yourself at increased risk of forming a kidney stone, which we see more often in the summer. We certainly see kidney stones in the winter. But there's, to some degree, there's a stone season that starts as the weather heats up. We're in a hot, humid environment. We form kidney stones at a much greater rate than folks that live further north, who have a less hot environment and a less humid environment than we do. Okay,
good advice. Drink plenty of fluids. Let's put up the information about Arkansas Urology, of course, associated with St. Vincent, but there's their information on the clinic on Centerview Drive, the phone number and hours as well. And we thank you for coming in.
Very good.
Taking
I
us some
appreciate you having me.
questions, some news we can all use. Appreciate it. Dr. Tim.